everybody, welcome back to Shit They Don't Tell You, Pregnancy Edition. Today I have with me Dr. Alexandra Mayer. She is the co-founder and co-owner of Ethos Integrative Medicine here in Scottsdale, where I am building my practice currently. And she specializes in aesthetics and women's medicine. So I wanted to bring her on today to talk about things we may not have considered in our cosmetics during pregnancy. Skin is actually the largest organ in your body, and the amount of chemicals that a woman on average absorbs is exorbitant. And that enters the bloodstream and then can affect fetal development. It's not something that's really talked about a whole lot. So I just wanted to touch on a few kind of key things that women should keep in mind, and things that they should kind of keep their eye out on when they're looking at cosmetics and different products that they are putting on their skin on a daily basis during this, hugely transformative time. So welcome, Dr. Alex. Thank you so much for joining me on my series today. I really appreciate it.
Yeah, thank you for having me.
Yeah. One of the first things I think maybe we want to touch on is just kind of what all the products are that we should be considering, that we need to start reading labels and that sort of thing.
So you should really be reading anything that touches your skin at this point. It sucks. And it's hard work. It really, really is. And there are some products that are better, easier than others, right? We've done a really great job of switching them out versus products like my kryptonite's like shampoo. I feel like finding a good shampoo when you have curly hair is just it's painful, So you should be reading pretty much anything that touches your skin. As you said, the skin is a really effective medication delivery system. And we look at this in two really conflicting ways. So in some ways in medicine, we put things into patches and we put things into creams, and we know that they hit the bloodstream and do a really good job of raising those medications. Yeah. Exactly. But then when it comes to putting complete junk on our skin, we're like, it's okay, it's not gonna get your bloodstream. It makes no sense. Yeah. So it should really be mostly anything that you're using. We could also get into, house care cleaning products and all that kind of stuff as well, but
people say that
thinking about it. Yeah. Exactly. I think we just need to go with the basics. Yeah. On average, women in the morning, from the time they get up to the time that they leave their house to go to work, women put on an average of 30 personal care products onto their body.
Kind of thinking through my morning routine. Yeah,
it's more than you think it is. It's more than you think it is. So, a little bit of changes really goes a long way, I think.
Okay. So kind of the overarching classes of chemicals that we should probably be looking out for and thinking of, we've got things like phthalates, parabens, BPA. How does someone actually look for those things on a label? Because you're reading the back, it's a whole bunch of words you don't recognize anyway, right? What do you do?
So it's a little bit of a nightmare, because honestly, we make things like code words. You pretty much have to have a science degree to understand it. When it comes to things like parabens, oftentimes paraben will be in the word, right? So if it looks like paraben, don't pick that up. The other thing is that there are, most of the time in skincare now, they will say paraben free, and then sometimes they will say phthalate free. Phthalates are the one that we really need to watch because fragrance equals phthalate.
Okay.
And so people want things that smell nice. Everybody wants things that smell nice. It makes sense. But if you're putting something that has a fragrance in it, that's a phthalate. And then things like formaldehyde, right? We think about formaldehyde.
I want to preserve the skin, right?
Yeah, I'm just gonna mummify myself. So that is a big one. And it's a big one in shampoos, and it's actually interesting. So there are some formaldehyde-releasing compounds that have actually been indicated in hair loss and class action lawsuits. So they are in a number of shampoos, and then they're also found in skincare. So we really want to watch those. I think brands are getting better at labeling, but they're not great.
Yeah, no, I totally agree. One of the things that I think I personally found pretty helpful when I was, during my 2 pregnancies was the Environmental Working Group actually puts out an app.
Yeah.
Which I recommend to a lot of my patients, either during pregnancy or as they're trying to clean up their environment to handle hormones in general, because it's super easy. It has a barcode scanner, you scan the actual product, and it gives it a rating. And it even simplifies it even more, giving it green, yellow, and red.
Yes.
Greens, you're pretty safe. There's a lot of research on the ingredients. Yellows, they have some questionable things. Maybe there's not a lot of research supporting some of the ingredients.
Yes.
And red is like,
yeah,
please stay away. This is
Don't
not
put
a
this
great
on.
thing
Yeah.
to be applying to your skin. Let's talk maybe a little bit about why we need to be avoiding these things. What's the actual problem with having this in our bloodstream when we're, dealing with hormones or dealing with pregnancy?
So we know that endocrine disrupting compounds change the way that the body either produces hormones or utilizes the hormones, right? And when we're thinking about pregnancy, we are growing a small human's endocrine system, right? So we want that to work well. We're also having a lot of hormonal changes in pregnancy, and that's the way it's supposed to be. So we don't want things that are going to be changing any of our endocrine system. We know long term, right? There isn't a lot of really good research on this, unfortunately. But when we start to question the fact that right now there's studies done on men, and they're saying that by I think it's 2050, that men are literally gonna have no sperm, because we've gotten such a dramatic reduction in men's sperm count. We see infertility on the rise. All of these things really start to happen before we think that they do, right? And so we can make a big difference with the way that epigenetics works through our child's life if we do a better job of taking care of ourselves to pass on our genetics and our epigenetics to our kids. I think that's why it's most important.
I think also, you have, some people might say, oh, it's just such a small amount. Does it really make that big a deal? And I really kind of caution women and people in general that an ounce of prevention is worth a pound of cure, right? The little things that you can pull out and just prevent that build up over time can really make a huge impact in the future. So
well, and I think that the reason why people have a hard time pulling stuff out has nothing to do with the fact that they don't want to be more clean or that they don't want to prevent. It's more that they can't find products that they like. And this is the problem, right? So I would talk at the medical school that we graduated from sometimes, and students would always say, well, don't you recommend organic skincare? Never.
Feels like garbage.
Never. Yes, because it doesn't work. And when stuff doesn't work, what do patients go to? They go to their product graveyard and they pull the most toxic thing and they put it right on their skin because it's going to do what they expect it to do. So you have to find that happy medium. That happy medium is really important. And you mentioned the environmental working group, which I think is amazing. There are sometimes where I've seen products again that are actually really safe and pretty clean, but they have ingredients in them like a vitamin A derivative that then they put as vitamin A, and it's
same but different.
Exactly. But I think it's a really good place to start. And then I think it's getting recommendations from people that really know what they're doing, because really at the end of the day, you can knock that 30 personal care products down by a lot by just putting stuff on your skin that actually works.
Absolutely. And you kind of touch on something, asking someone who actually knows what they're talking about. I love OBs. My best friend is an OB. You guys are great. You don't know skincare.
No.
So that is not the place to go to ask for recommendations, unfortunately.
Yes.
But on the same other side of that same coin, your dermatologist doesn't necessarily know pregnancy. So you really need to find a provider or a healthcare individual that understands where those two things come together and 100%. What the needs are, what the lookout points are.
100%. I think that's really, really important.
So the next thing I want to talk about, and you kind of touched on this already, is vitamin A derived products.
Yes.
We're all very familiar with Accutane bad pregnancy. Yes?
Yes. Accutane very bad in pregnancy.
And I think a lot of times vitamin A products or vitamin A derived products kind of get lumped in with that and thrown out with the bathwater.
100%.
Talk us through why that may not be necessary.
So when we're thinking about vitamin A derivatives, right? First of all, any oral vitamin A in pregnancy that's actually in the form of vitamin A is definitely going to be a no-no. You want to be really careful about adding any additional vitamin A. And I do mention this because sometimes I find patients are part of forums and things like that, and they may not, there's all these biohacking Facebook groups, right? And people get very interesting recommendations from these places. So oral vitamin A is a no-no. Then we go to topical vitamin A, right? And we can go all the way from tretinoin, which is what we think about when we think about a medication version of a retinol, all the way down to a natural vitamin A derivative. Tretinoin, retinols in pregnancy are not considered safe. So we do not use them in pregnancy at all. But there are topical vitamin A's that can be definitely more safe in pregnancy. They still can stimulate some skin cell turnover, which is really what retinol's so good at doing, is stimulating skin cell turnover, but without those kind of harmful effects that we think about with the strength of getting to tretinoin. The other thing with that is that they actually are much less sun sensitizing, which is really, really important, because in pregnancy, we want to be extra careful about what we're doing on our face that is sun sensitizing, because we don't want to put ourselves at higher risk for things like melasma.
Gotcha. So you kind of mentioned that the vitamin A derivatives are really good at cell turnover. What indications are you actually looking at there? What is that going to be treating?
Yeah, so oftentimes I will use this to treat like red, inflamed, bumpy kind of skin. I really only use one product that has a vitamin A derivative in it, and it's the combination in this product of it's a vitamin C, vitamin A, and then some olive leaf, and it is super anti-inflammatory. So I use it in any patients who have cystic acne, and I use it in any patients with like red, bumpy, dry, irritated skin. That's really the only one that I'll use. And what I like about this too is that it has the vitamin C in it for the anti-aging, antioxidant component, which is really important, but it's not a super strong version of vitamin C, because vitamin C again can be kind of irritating. So if your skin is a little inflamed, that can be adding a little bit of insult to injury. So this is the one product that I like. For the vitamin A derivative. It is Pro Heal Serum by IS. So IS's line, the majority of their line is pregnancy safe, which is amazing. And this product is my go-to for inflamed skin. My go-to.
So I think something that women need to consider with everything that we're talking about right now is risk benefit, right?
100%.
What are you actually looking to treat? What effects are you looking to cause? And what are the potential side effects? Right? So if you're willing to have bumpy red skin through the 9 months, 40 weeks is actually longer than 9 months of pregnancy.
Things they don't tell you.
Yeah, right? You're start doing that, be like, wait a second. Then, maybe, if that's not a risk factor that you're willing to dabble with, stay away.
Well, and you might choose to go more just supportive. So like the very first thing I would always have my patients change would be their cleanser. And this is like a very unpopular opinion, because with skincare, we like skincare to be sexy. So we want to be like serums, and we want to be creams, and we want to be all of these things. And really, if you just change your cleanser
routine at the end of the night.
Yeah, absolutely. I actually don't, which is hilarious, because I do this for my for a living, and I'm like, cleanser, treatment product, maybe a moisturizer, I'm done. Like at night, I'm done, I'm going to bed. And so I think changing your cleanser makes a huge difference. And so first of all, if you're using bar soap on your face, stop it. Please stop. Please just don't do it. Don't do it. Never put bar soap on your face ever, ever, ever again. So the pH of soaps is different, right? So if we go to bar soap, we're at a pH of like 9.5. We should be at a pH of 5.5 for healthy skin. But even when we're getting like a foam cleanser, a cleanser that has a little bit of like more of a sudsing action, that usually has a higher pH. That can be really irritating to the skin barrier. And then the opposite is true of like a cream cleanser, right? So they tend to be a lower pH, but they tend to not clean the skin quite as well. So if you have acne, that's not gonna work. I would never put a cream cleanser on my skin. You could not pay me money to clean my face with a cream cleanser. It's not gonna work. And so I think sometimes you can just change one thing and not necessarily have to like go and do a million things and then have to check if all your million products are pregnancy safe if you do the right step.
That makes a lot of sense. So I think the next thing I want to dive into a little bit, you kind of touched on a little bit, melasma.
Yes.
Let's start with, what is melasma? Who gets melasma? And what do we do about it?
Good question. So melasma is that mask that people get in pregnancy, that dark mask, and it usually shows up upper lip. It can show up in like the C from the forehead down, are kind of the most common places that we see it. Sometimes we see it chin and cheeks, but those are kind of the most common. In terms of who gets melasma, the theory in melasma is that it's caused by increases in hormones, and we don't have very much else information. So genetically, right, patients with darker skin tones are more likely to get melasma. Mm-hmm. So particularly Hispanic and Asian descent are more likely to get melasma. Mm-hmm. But that doesn't mean anything because I have a ton of Caucasian patients that are pretty fairly light complected in terms of like a Fitzpatrick scale that also have melasma. Yeah. So in terms of what you're thinking of in pregnancy, so there's actually interesting research kind of coming out of the postmenopausal community, because what they found is that postmenopausal patients who are put on hormones can have an increase in melasma. And they find that the more progesterone they're on versus estrogen only, which I would not recommend if you have a uterus. If you're watching this, don't do this. No. But if you're only on estrogen for some reason, let's say they don't have a uterus, they weren't given any progesterone, they don't tend to have that increase in melasma the same as progesterone patients do.
That's really fascinating because in pregnancy, obviously the progesterone is super high. That's what your placenta is pumping out to, form good attachments and that sort of thing.
Mm-hmm. Yeah, so it logically makes sense, right? If you're looking at am I going to be at risk for this? If you went on a birth control pill and you ended up having some darkening of your skin, then you're probably at much higher risk for melasma.
How about family history? Does that play any role? If your mom got melasma, are you more prone to it, or?
It does. There is a genetic component. We definitely don't have that as figured out, I think, as we would like to, but sure. There is a genetic component that plays a role. It's kind of like genetic mixed with ethnicity. Mm-hmm.
Makes a lot of
creates
sense.
Our risk factors the most.
Yeah. Tangent issue. Mm-hmm. What you kind of mentioned with, we know this happens, we don't have a lot of information. It happens a lot in the female community. Mm-hmm. A lot of things happen that are common. Mm-hmm. Doesn't mean they're normal or that you should have to live with it.
100%.
And I think a lot of times as women, we put ourselves at the bottom of the totem pole and take care of everybody else first. Mm-hmm. And so because of that and the way that, we treat ourselves, the way society thinks about us, we don't do a lot of information gathering, and we do kind of write off a lot of symptoms and a lot of early clues of things as normal.
Absolutely.
So it's a little soapbox issue of mine. Probably hear it more in this series, so I apologize.
I think it is really important though, because the majority of medical research is done in men.
Yeah.
And so
majority of research in general. Did you know that seatbelts were only tested for a male body? They are not actually safe for women.
I did not know that.
Yeah.
Interesting.
And in fact, you are more likely to have serious problems because of your seatbelt.
Huh. I did not know this.
Yeah. They don't tell you.
Exactly.
So anyway, moving on to what can we do about melasma? How do we prevent it? Yeah. How do we treat it?
So the number one thing that you can do for melasma is avoid sun exposure on your skin. So when we're thinking about this, what we're thinking about is wearing a good sunscreen, a physical blocker only, which I will talk about in a couple minutes, but a physical blocker only, avoiding sun exposure on your skin from those peak hours of the day, even if you have sunscreen on from about 10 to 2, and then wearing sun protective clothing. That's the number one thing that we can do. When we're thinking about sunscreens, so they've actually done research studies where they've taken the serum, I believe it was of teenagers, and checked the amount of basically octinoxylate, which is the active ingredient in sunscreens. Yeah. And it was astronomical. It's crazy. So you are absorbing the chemicals in your sunscreen. Mm-hmm. On top of that, the way that chemical sunscreen works is that it actually absorbs the sun rays in and then kind of locks them in, so to speak. Mm-hmm. If we're thinking about melasma and the idea of creating, and it's worse with heat, right? So trapping UV rays in the skin doesn't make much sense to me. That's why a physical blocker is going to be better. A physical blocker is going to work more like a mirror. It's going to bounce off that sun ray to go somewhere else.
Right.
When we're thinking about this, we're looking for zinc and titanium oxide. Mm-hmm. Zinc oxide is best against UVA, so the aging rays. It also protects us against UVB and blue light. Mm-hmm. And then titanium oxide is really good against UVB, but also UVA. And then the formulation matters. They're really hard to find.
Yeah, that's one of the struggles as a very pale individual. I'm sure you sympathize here, is finding a sunscreen that you don't hate.
Yeah.
Because a lot of them I'm white enough. I don't need a mask on top of that.
100%. Or my favorite thing that people say is like, oh, it's universal tint. And then they pull out this orange cream that you're like, huh.
I'm not that color. I don't know.
And then I've had countless reps say, it's okay if you rub it in longer, it'll become your skin tone.
That's not how pigment works. I'm sorry.
So yeah, it doesn't work like that. Yeah, picking a sunscreen is hard work, and I've tried almost every single one. So this is actually the reason why we brought on our own line, was literally because of sunscreen. Because I had tried so many. I tell my patients every day to put sunscreen on their face, and I wouldn't listen because it always gave me acne and made my skin feel like crap, so I didn't put it on. So this one is formulated with hyaluronic acid, so it goes on light. It's got a good tint, so it's like actually I would call it a universal tint as opposed to like not universal. It's not orange, and it is a physical blocker only. The tint in tinted sunscreen, so I've had a number of patients tell me that they hate tinted sunscreen, and I think that that's because of what I'm experiencing, where they tell you that it matches and it doesn't. The tint is actually really important because it protects you against visible light. So it's the only thing that protects the skin's visible light. And when we're thinking about melasma, the more we do in terms of protection, the better. So a tint is actually going to be really important. And then of course you don't want it to have any of like the hidden things in it.
Right.
So,
and that's one of the things that I actually ran into when I was looking for a sunscreen when I was going through my first pregnancy. I went and purchased a brand that is very expensive, available only at department stores. Promoted by celebrities as being super clean, and I brought it home and I turned it over, and it had a endocrine disruptor in it as the main ingredient. I have never been so upset about a purchase in my life. It may have had something to do with the hormones, I'm just saying, but I was very upset. I felt swindled, honestly.
100%.
And so that's when I really started scanning everything with that EWG app and being really diligent.
Well, and what's interesting is like, I think that when it comes to what's going on in Hawaii and the fact that they've changed like reef sensitive. So first of all, we know that the chemicals affect the genome because it's affecting the reef. But what's interesting is that all they've done is switch out one for the other, which is what we usually do, right? When we don't really want to change things, we just switch out one for the other. So we've switched out oxaloate for another precursor with oxalate at the end, right? And we just keep swapping them. It's kind of like they just keep pulling the wool over consumers' eyes and hoping that they don't notice. So that's why you really want to go physical protection only.
That's great. So let's say you found this after you've already been through your pregnancy, and I'm sorry if you're that individual and you have melasma now. What can they do about lightening, any dark spots that they're uncomfortable with?
Yeah, so there is actually other things that I think you should think about for prevention before we get to that point. And really that is going to be using a good cleanser, which we talked about, so avoiding inflammation in the skin and not using things that's foaming. They always say using like a more natural cleanser, which I don't agree with. I think you should go like pharmaceutical grade, but really clean and like get it to work and do what we expect it to do. And so if you do that, that's a good first step. The other thing that you can do would be something that's more anti-inflammatory to the skin. Like we talked about the Pro Heal as being a really good anti-inflammatory option to the skin. Because at the end of the day, right, melasma is made worse by heat and inflammation. And we know that there's an inflammatory component to that tyrosinase enzyme creating more pigment, right? Whether that's the entire picture of melasma, it's not, but it is part of it. And then you can use some tyrosinase inhibiting things. So this is good for if you are starting to get melasma. There are some pregnancy safe options that are considered like lightening agents that are actually pregnancy safe. But even if you're kind of worried about melasma, doing a tyrosinase inhibitor that's safe could be a really good preemptive strategy. So I will list off some of the ones that are considered safe. So things that we can't use. We cannot use retinols, which we talked about, and we cannot use hydroquinone, right? Hydroquinone is a very controversial topic anyway, but in pregnancy it is a big no-no. What we can use is we can use things like glycyrrhiza, so like licorice root, which is interesting because you can't use licorice root internally during pregnancy at all, but it is considered safe topically in the amount that's in in skincare.
Okay.
So that's a really, really good option. That is, again, a natural tyrosinase inhibitor, so it's gonna prevent the production of melanin in the skin, right? That's how most of the things that we're gonna talk about work. Azelaic acid is also a really good pregnancy safe option. That's going to have a little bit more of a skin cell turnover component to it because it does have an acid in it, right? And what's interesting is that this is also good for acne and is very pregnancy safe, so something to consider. Kojic acid is another one. So kojic acid is usually created from, well, there's a number of ways we can make it, but one of the ways we get it is through mushrooms. So sometimes skincare that has more botanical based, like the IS line's very botanical based, will have mushrooms in it, and the point of that is for the kojic acid.
Got it.
And then other things that you can use, so you can use vitamin C. The science of vitamin C matters.
You have a whole video
I
on
do
that,
have a whole, I can have a whole soapbox on this, but the science of vitamin C matters. The way that we have to formulate it, it can be very acidic if it's not formulated correctly. It doesn't have a lot of shelf stability. So if you're going to buy vitamin C, please buy a good one, or else you may as well just flush your money down the toilet.
Rub your dollar bill on your face first, and then.
Perfect. Yeah, that's how we're gonna fix it. Yeah, 100%. So, but that can be a really, really great brightening agent. It also is anti-aging in general. So there's very few things that I think with vitamin C we can go wrong with, other than purchasing a not good one. The other thing is that there is an oxidative component to melasma as well. So vitamin C is a potent antioxidant. Yeah. So we have to think about that. And then other things that I don't use as often that I have written down would be like ferulic acid, which they usually put in vitamin C products. I personally hate ferulic acid. I hate the feel of it. I hate everything about it. So I would never recommend this, but in theory, you could use it.
In theory, it's a thing that's possible.
But those are really, really good options. And then one of the more stronger lightening agents that we could think about that is safe would be 4-N-butyl-resorcinol, which is a big mouthful. It is pretty potent. I'd probably go with one of the other ones first, and they do work really, really well. And it's something that you can just put on as a prevention over top of your entire skin.
Awesome. That's really good information. So that prevention aspect, how about treatment? Are a lot of those things also good for
100%.
Reversing that after pregnancy?
Yeah, 100%. It's the exact same. When it comes to after pregnancy, they say that melasma should lighten, and in the majority of cases it will. If your melasma doesn't lighten after pregnancy, one of the things you might want to consider is whether or not you went on another birth control, like a hormonal birth control, especially based on the research in postmenopausal women of progestin only, which is usually what they would recommend if you're breastfeeding. Right? They're not going to recommend a combo pill. They recommend progestin only, which could actually be making that worse. So if it's not lightening, you might want to consider looking at what's your birth control agent, and then are your hormones balanced, and then using the lightening agents after pregnancy, after breastfeeding. If it really doesn't lighten, we can go into things like hydroquinone, or some chemical peels. We have to be very, very careful, but we can go into more treatments. In the majority of patients, it does lighten though.
So we talked a little bit about, we've touched a few times on acne. One of the most commonly known and available treatments for acne is salicylic acid.
Yes.
Not good in pregnancy.
So, actually, salicylic acid is considered safe in pregnancy under 2%. Okay. And so, really, they say 1 to 2 times a day under 2%. The majority of my patients with acne do not require salicylic acid put on their face 2 times a day. I have a number of patients that come in, not during pregnancy, but in general, where they're using like a salicylic cleanser and they're using pads 2 times a day and they have a serum. It's major overkill. Once a day is usually sufficient, under 2%. And then if we're doing this, that's a beta hydroxy acid, which means that it dives deep down into the pores. It's going to clean them out, right? And we usually want to pair these with alpha hydroxy acids, like a lactic acid or a glycolic acid, to work on the surface of the skin and keep those pores clean and like unobstructed, right? So lactic acid's also considered safe. And then glycolic acid is considered safe under 7%.
Okay.
7% glycolic acid is a decent amount.
That's a lot of,
That's a decent amount. So,
I mean, I like my skin intact, so
exactly.
Not...
We're going super aggressive there.
You do like burning my face off with lasers, but
I do. Burning people's face off is my favorite pastime, but so I do think that that is one of the things that, and even when you see like an OB, sometimes look like, oh, salicylic acid unsafe. Mm-hmm. Technically, over 2% is considered unsafe, under 2% is considered safe. If you really want, if your acne is not terrible and you really want to go less aggressive, you could go with something that has like a willow bark in it, which is also considered safe. And the body technically converts a compound in that into salicylic acid, which can be helpful. But again, if you really have acne, that's not going to be great. Yeah. I have a patient recently, so we have been treating her acne. Her acne was completely under control. She got pregnant with a baby girl, and her acne went crazy. And so she called and was like, I can't use anything. And I put her back on our clear skin pads, which is like my favorite acne treatment ever. And her skin calmed right down when she got that salicylic acid back. So I do think that that is a misconception. Yeah.
And, that's something we'll also be talking about a lot in this series is some of the misconceptions that people have. Because we get very general recommendations in that 5-minute appointment with your OB. And so they need to make sure that, they're giving you the broad picture of things that may be harmful.
100%.
Understanding why those recommendations are being given to you, what the actual risks are, and then making an informed decision on is this a risk you're able and willing to tolerate, or absolutely not. It's not something that I want to toy around with.
100%.
Very common, unfortunately.
Yes.
I think that's everything that we wanted to chat about today. If I missed anything?
I think the only thing that I would add is treatments in pregnancy. Okay. So a lot of patients think, okay, I can't get any treatments in pregnancy if my skin is really bad.
And by treatments, you're talking about like procedures of like lasers, Botox,
microneedling, filler, etc. Yes. Okay. So the majority of treatments in pregnancy. Absolutely. The majority of treatments in pregnancy we can't do, right? So like Botox, for example, we don't inject in pregnancy. Most of that's because we don't study it in pregnant women because that doesn't sound very safe, right? So we don't do that. We don't do fillers. We don't do things like RF microneedling or lasers. However, regular microneedling, it can actually be pregnancy safe. We want to be careful what numbing agents we're using. And then we want to be careful, I would say, how aggressive we're going, especially knowing that there is an inflammatory component in the skin with the rise in melasma, right, during pregnancy. You want to be careful and balance that out. I think sometimes patients always think, and some providers, unfortunately, who don't know what they're doing, think, oh, more aggressive is better. That is not true. But that is a pregnancy safe option. And even my patient I just mentioned whose acne went crazy, her OB told her, oh, you've done microneedling in the past, go back and get that done. And sure enough, it helped calm down her acne quite a bit. That's another misconception that I hear a lot is like, oh, I have active acne, so I can't do microneedling because you're going to spread around the bacteria. I have never once in my practice seen that actually be effective, like actually be the case, never once. So, but I do think that that is a good option for people if you're looking for it, right? Again, it's about that risk-benefit ratio and seeing what's available to us. But if you've really spent a long time treating your skin for something like acne scars, and then you get acne again, that can be really quite traumatizing. So we want to balance that out.
Yeah, no, absolutely. And mental health, especially mental health during pregnancy, is a topic that we'll be talking way more in depth about going forward. But things like that you may not consider, may trigger someone that's had very severe cystic acne and it's coming up again, and it's the whole sense of loss of control of your body because there's another person sharing it with you for a duration of time. And
100%. And I think that there is, especially when it comes like our skin, there is this mental attitude of if we just put everything to the wayside, right? If we just decide, okay, all I'm going to allow myself to put on is like the most clean sunscreen I can find and maybe a good cleanser, please, hopefully a good cleanser, but hopefully a good cleanser, and that's all we get, then there is this aspect of we're starting this mental journey of we sacrifice for our kids forever. And that is, I think, both important and
Yes.
a dangerous road to go on.
Yes.
And I think that there's a balance in that sacrifice that needs to happen, where you still get to take care of yourself as a pregnant person. You still get to take care of yourself as a mom. And I think if we can have more of those conversations, then patients will do better long term.
Absolutely, yeah. And that's a conversation that you should continue having with your provider before pregnancy, during, and after. You know, it's a trite saying, but you can't pour from an empty cup, right?
100%.
And if you start emptying your cup before the kid's even here, like that's a recipe for disaster and
Absolutely.
burnout down the road.
Absolutely.
Well, thank you so much. I really appreciate it. I hope it was informative for everyone out there. We're putting together this series, and it's something I'm really passionate about, just, you know, being a mom, being a doctor, and realizing how much I didn't know. So, yeah, that's why we're working on this, and I'm really grateful that you were able to, you know, really provide a lot of great information on this topic.
Awesome. Thank you so much for having me on.